Welcome, everyone. I'm Catherine Lavender, the Data Project Manager for NACDA, and this is our NACDA Data on Aging podcast series. NACDA is the National Archive of Computerized Data on Aging at ICPSR at the University of Michigan and is funded by the National Institute on Aging. We seek out and preserve data relevant to gerontological research, kind of like a data library, curating the data as needed to promote effective research use. And we share the data with the research community free of charge. We are proud to say that we are one of the largest libraries of data on aging in the United States, offering opportunities for secondary analysis on major issues of scientific and policy relevance. We hope to connect with the gerontological research community using this podcast series and plan to highlight data resources and researchers, talk through data concerns, and learn the stories behind the projects. Find out more about NACDA and ICPSR by visiting nacda-aging.org. Today, our guest is Dr. Jessica Finlay, Research Investigator at the Social Environment and Health Program Institute for Social Research at the University of Michigan. She uses qualitative, geospatial, and mixed methods to investigate the role of built social and natural environments for health and well-being in later life. Welcome, Jessica.
Thank you for having me.
Thank you. So we'll just jump right into our questions. And could you tell us a bit about, well, not a bit, tell us as much as you want about how you got involved with your research and, a little bit more about the research.
Sure. So I'm a health geographer and environmental gerontologist. So I'm interested in where people live as they age and how it affects their health and well-being. And this interest in aging populations really began during my PhD studies. Both my personal and professional world really opened up to aging adults and how vulnerable they were to their neighborhood context and their communities and how much of an impact it had on their health and well-being. So my PhD research was at the University of Minnesota, and this focused on what neighborhood infrastructure, services, and amenities are necessary to support health and well-being in our aging populations. And I take a very broad perspective to health to include physical, mental, social, and cognitive health and well-being. And so I conducted seated and mobile interviews across the Minneapolis metropolitan area to ask older adults about their homes and neighborhoods and what they felt needed to support them while they aged in place. And one of the greatest fears that I heard about was cognitive decline. So older adults roughly knew how to navigate physical impairments. For example, depending on their resource level, they could install a grab bar or put a chair in the shower or get a walker or a cane or use a wheelchair. And cognitive decline in comparison represented huge unknowns and huge fears, a very relatable fear of losing yourself and also your independence to live at home and in your community. People would say to me, what if I leave a stove unattended and cause a house fire? What if I start to wander? What if I need really costly care in a long-term care setting? Or what if I become a burden upon my children, my grandchildren, my family and friend networks? And so this experience, hearing this over and over again, as well as experiences of my own grandparents who began to navigate Alzheimer's and dementia, really inspired my postdoctoral research on neighborhood contexts of cognitive decline.
Thank you. Yeah, that's really interesting. And I would say that I'm inspired by your interest in that. And that fear of cognitive decline, I would say I even have that fear, and I'm not near, the older adult population age range. And, this is kind of just a follow-up question to that. When you hear that fear from people, or when you talk with other researchers, are there any resources that are generally recommended to, support people? I mean, I know that there are, brain games and things like that, but I'm just curious.
Yeah, it's a great question. We can all relate. I also am a young mother, and I think about risk of Alzheimer's for my own children and myself. It is something that you don't just suddenly become old. It's something we think about as we accumulate exposures and behaviors as we age across our life course. So there's a really, this is a more academic resource, but there's a really important paper that came out in the Lancet in 2020. And this looked at potentially modifiable risk factors for Alzheimer's and dementia. And they have found in combing through a ton of research on dementia prevention and risk, they've found that there's 12 potentially modifiable risk factors that could help you limit your risk for developing dementia. And they think that these factors together could theoretically prevent or delay up to 40% of cases of dementia worldwide. So there is things that you can do. There are small changes you can make to your lifestyle to help delay risk, so or prevent risk. So some of those include, minimizing diabetes, trying to treat hypertension, maintaining a healthy weight as you age, trying to be socially active and physically active as well. So kind of keeping both your heart and your brain healthy, avoiding excessive alcohol. So there are steps that we can take to minimize risk as much as we can. Of course, there is a genetic component to Alzheimer's, but there is a lot that you can do. And both the National Institutes of Aging have a lot of public resources available on their website. If you just type in, for example, risk for Alzheimer's disease, it's often one of the first sites that pops up. There's also great resources from the Alzheimer's Association. They are doing a lot of work to provide, very straightforward explanations of what is dementia, what are the types of dementia, what can you do? And then the AARP as well, the American Association of Retired Persons, I believe they also have resources to help think about healthy lifestyle behaviors and what changes you can make to help decrease your risk for developing Alzheimer's and dementia.
Thank you. That's really helpful. So can you talk more about the central objectives of your recent work and some of your key findings, and just anything else you think is, mostly notable?
Absolutely. Yeah. So, I just mentioned that paper that had those 12 modifiable risk factors, and I'm a geographer by background. So I am taking that kind of geography lens to think, okay, how can environments structure some of these risk factors? We often focus on kind of individual level interventions, but the places we live, the everyday context that we navigate can have a huge impact on our abilities to be physically active and socially engaged, and limit risk for things like head injury. And so I think about what can our environment do? How do we build better neighborhoods to encourage and enable healthy lifestyle behaviors so people can limit their risk for Alzheimer's and dementia? And so really that's kind of what I'm developing a new concept to measure how supportive an area is to cognitive health among aging residents. And then so I kind of focus on 3 major lifestyle pathways that we can again, kind of reduce risk. And that is being physically active, socially engaged, and cognitively stimulated as you age. And I'm using a mixed methods approach to do this research. So I'm asking people about how they perceive and use their local neighborhoods as they age, and then testing whether or not having access to these places might be associated with better cognitive health outcomes among older adults in a large national aging sample called the REGARD study. And I can go into a little more detail on REGARDS in what follows. But we, in kind of a broad overview of it, we have found, for example, that living close to and having access to recreation centers, so places to be, physically active, to also engage with other people, having access to local civic and social organizations, so things like parks and civic boards, veteran associations, racial and ethnic group organizations, volunteer and civic committees. Having access to those are linked to higher rates of cognitive function in our large national aging sample. And we also think about barriers too. We don't have equally distributed, in neighborhood amenities and hazards. And so we think about, for example, highways. They are both sources of pollution that can be harmful to the brain and to our bodies, and they can also cut us off from accessing some of these key resources like your local art center or museum or recreation center. So we're kind of putting this together in models that are drawing for the qualitative side upon that dissertation research I mentioned that was Minnesota-based, and then testing these ideas in the large national REGARD sample. And Regards is a really great source for doing aging and disparities research. It is over 30,000 aging non-Hispanic, Black, and white Americans. It's been ongoing since 2003. And so it stands for the Reasons for Geographic and Racial Differences in Stroke Study. And on average, at baseline, so between 2003 and 2007, participants were on average about 64 years old. And they've been tracked every year since then to kind of see how they're doing for their physical health, as well as their cognitive health. And then what we're using as well is we know exactly where people live. So we have their home addresses. And so we can see over time where they live and see, okay, what do you have access to? Is there a park nearby? Do you have access to a library, to a museum? Are there eateries in your local area to go and see other people? And so we're testing whether having access to these resources might be linked to better cognitive health in this aging sample.
Nice. Yeah, it sounds really interesting. It makes me think about sidewalks. Not every neighborhood has sidewalks, and people will walk in the street, but it adds to the risk, right? And even if it's a lot of grass, it can be unstable terrain, particularly for older people with maybe less mobility. And so just something as simple as access to sidewalks in a neighborhood could have a huge effect on your physical activity level.
Absolutely. And we don't necessarily need to make drastic or dramatic changes to our environments. It's sometimes small incremental tweaks that make it easier for more people to get out and about and use local amenities and services. So for the example of parks, we are seeing a positive and significant association between having local parks in your area and having better cognitive health outcomes. And the qualitative research told us these are places for people to walk and to bike and to see other people, even just sit on a bench and watch other people go by and feel connected to others. I think we can all relate to that, especially with some of the isolation that happened with COVID-19. And we also hear about some desires for more senior specific infrastructure. So for example, having chess boards out in a park, or having a playground that has some features for older adults to exercise as well as children to play. Or having things like just smooth paving and well-plowed sidewalks and lighting in bathrooms. So it doesn't take dramatic changes. Older adults, if anything, found kind of very large, for example, national parks. That's not where they went on an everyday basis. They often valued more just those even small little pocket parks, they can be called, the size of one residential lot that's been turned into a little bit of a green space, a few benches, a place to gather. Those can be very meaningful, and they're not necessarily huge investments or huge overhauls to our communities and neighborhoods. And the other piece that this exposes is the neighborhood quality. The sidewalks, for example, they're not equal across communities. We know that, for example, plowing levels are often can be happening in higher income areas earlier, or more urban areas that it's easier to get around. So thinking about who has access and who doesn't have access is really key to some of this work, and trying to find opportunities to really prioritize an investment in neighborhoods that are underserved and often at greatest risk for developing Alzheimer's and dementia.
That's really important. Thank you. Yeah.
You're welcome.
So you talked about the regards data, excuse me. Can you talk a little bit about accessing those data? How someone else might go about trying to use those same data?
Sure. So Regards has a website online that anyone can go look at and start to learn more about. And it's also really helpful, I think, to read papers that have been published using the data to see who's using it, how they're using it, and what they're looking at. Regards, this is, they do have a lot of very sensitive private health information about participants. So if you want to use the data, you do need to apply to use it. You have to develop the kind of appropriate ethical board applications at your institution, and also need to start talking to those Regards investigators to describe to them how you want to use the data in very specific terms, and put a proposal together to conduct a study with the Regards data. And so for me, it was really, I was fortunate to be able to kind of come onto a project that was already just getting started. So my mentor, Dr. Philippa Clark at the Institute for Social Research, she had already secured that access and that funding to kind of look at this data in more depth. But it did take us some time to learn it. Even after we began to get it, it was reading a lot of code books, figuring out, especially for longitudinal data sets, figuring out how the different waves worked, what is being asked when. For example, there was a subset of participants who had a second in-home visit. So they did a first in-home visit at baseline, and they did a second in-home visit for a subset of participants in what they called the surf wave. And it took a little bit to, okay, when did that get asked? Who got asked that? You know, things like that, that we were able to use some extra data from those surf participants, but it took us a while, excuse me, it took us a while to figure out how the data was laid out and how best to analyze it.
Thank you. Yeah. So it sounds like it was restricted data, and we have restricted data like that at ICPSR that people have to apply for, and those applications require different items that, you know, for the different levels of risk that the data are. I have a follow-up question to that is, do you access it through like a virtual data environment?
So they send us the data to use and give us access to it. So we're
Okay.
drawing upon the demographic information of participants: how old are they, gender, race, where do they live, and their cognitive health testing. And then we're in on our secure servers, we're then linking it to NACDA. So this is a National Neighborhood Data Archive. And it's a publicly available source of data on neighborhood built social and natural environments. And so we were able to take the residential coordinates of where people live and then link it to that NACDA data set to figure out, you know, as I mentioned, how many parks are nearby, what are the presence of highways or polluting sites, and other features of the environment where they live, and even weather data. We've had some fun papers that we've linked to look at whether being exposed to a lot of rain and snow and cold or hot temperatures, does that have any association with cognitive health scores in the regard sample?
That's great. Yeah, in Michigan, I think I read some years ago that we get less than half sunny days in the year, and that includes partially sunny days. That's not even full sunny days. So yes, I am sure that the weather has something to do with our health.
Absolutely. I grew up in Canada, and then I've now lived in Minnesota and Michigan. So I am very familiar with, you know, extreme winters, extreme weather, and the ways it kind of impacts our health and our abilities to get out and about, especially if you're an older adult who may be navigating both mobility impairments as well as potentially cognitive impairments as well.
Yeah. Yes. Okay. Well, thank you for all of that. And you've talked a little bit about some of your findings. Are there any other major findings that you wanted to mention?
So I talked a little bit about kind of each of the pieces in isolation. We're starting to put them all together in like one big model to see what matters most to cognitive health in our kind of aging populations from a neighborhood's perspective. And so interestingly enough, civic and social organizations were kind of the strongest positive association that we saw, whereas the biggest negative association was highways. So living close to highways, it makes sense. They're both barriers to your activity levels and ability to access places. And they're also sites of sources of both air and noise pollution that can be harmful to the brain. So this has been something that we're working on. We're also running models that are stratified by race, gender, and education. We know that neighborhoods are not one size fits all. They're not going to have, just because you live close to something doesn't mean you can use it. It also doesn't mean that you feel welcome there. We know that institutional racism is pervasive in many of these types of places. And so just because it's nearby, you may not necessarily be welcomed into that space, or it may not have the same kind of cognitive health benefits that it may have, for example, for white populations. And we did see this, for example, in art sites and museums, we saw a steeper and more significant, steeper positive association between having access to arts and museums among our white participants than our Black participants. And this really reflects what we heard from the qualitative research as well, where older adults weren't necessarily welcomed into those spaces given their socioeconomic position or their race and ethnicity. So I think in what I'm moving towards is that we need to be really critical, again, in thinking about how unequal our neighborhoods are and how we're not always welcomed into particular spaces given who we are. And so we're moving our work forwards to really consider how might these neighborhood features vary depending on who you are and where you live. And so I think that that's a really important thing to remember is we do see really considerable inequities in risk for cognitive health. For example, Black Americans are at a higher risk of developing Alzheimer's dementia, and potentially it's in part due to the often more underserved and underrepresented communities in which they live that don't necessarily have those health promoting resources to help them age in place well across their later life.
Thank you. Yeah, I think it's important to highlight that. I mean, if you think about Detroit, it's the motor city surrounded by freeways, and that's just kind of what really struck me, went through my head as you were talking about that. And
yeah.
You
just reminded me too, one of the ways we're moving this research forward is to actually develop a map of the whole country. And you can type in an address and see how supportive it is to cognitive health or not based upon what's there. And so we're sort of doing a prediction of, okay, are there positive amenities like those civic and social organizations and art sites and rec centers, or are there negative features such as highways and polluting sites? And so we've mapped every census tract, which is a unit of about 4,000 people across the entire country. And so we've done it for every urban and suburban area in the United States. So you type in an address and see how it scores. And when you look at Detroit, for example, and the metro area, you can see very stark patterns of areas of high cognability are on that further ring, kind of that suburban and extending outwards from the city. You see what our high cognable areas are in blue. So it's very blue around the city. And then as you move in to the city center, it becomes overall, we have it in yellow and an orange to indicate low cognability is the word we're making up for it. So you can see that there are unsupportive resources and a greater concentration of hazards and just barriers to community access. So it definitely, you can see it in the landscape, how it is so framed too by these broader structural inequities that we have.
You can do some really cool things with maps. It's so great to see like all the projects coming out, utilizing maps and interactive maps. And, you drive around Detroit and you can see the community, trying to, I don't know, bring art in. There are so many murals, beautiful murals around the city, and the DIA is there. I could get off track, but so it's hopefully your work and other people doing work like yours highlights those communities so that they can get the support they need to, enhance the neighborhoods so that people can be healthier overall.
Absolutely. And that's one great point. And one of the limitations of this work is we're capturing kind of formal places. So institutions like DIA, art institutes and music halls and theaters, we don't always capture in our models those more informal spaces where people are using the spaces to promote community and health and well-being. So, perhaps a community garden would not necessarily show up in our map. Or like you mentioned, those beautiful murals that can be such important places to gather and to appreciate artistic expression. They're not always captured in our models. So that's something we're trying to work on moving forwards is, can we get a little more micro level to capture those kind of informal elements that are important to our health and well-being and more community driven than say what you might plot on a map. But there's just so much to do with this project. I got really excited about it and thinking about it. We're just at the very early stages. We have a wonderful community advisory board giving us advice too on how to frame our research in accessible ways, how to make this mapping tool really accessible to a broad group of users, and then hopefully highlight areas of strength. Like I said that, for example, Detroit was largely lower scores, but there are some very blue zones, some high cognitivity pockets of amazing stuff that's being done in Detroit, for example. So let's draw upon those strengths that we have in communities and work to extend them out further, as well as prioritizing investment in those very underserved areas.
Very cool. Yeah, so much potential. So you've touched a little bit on some of the challenges that you've run into already. Can you talk some more about the challenges of the research process for you and the data that you've worked with?
Sure. So I'm a qualitative researcher by background. I'm used to going into the field and just talking to people and doing everyday things with them. And so for me, learning big data, like big quantitative data sources, was a bit of a learning curve for me. I've had to take stats courses to learn how to handle some of our modeling approaches and learn math. I never thought I'd be doing all of this, but it's a nice way to kind of blend the strengths of really in-depth subjective qualitative insights with that broad quantitative data that you can get from across an entire country. So I think that's one element. I think, as I mentioned already, learning and organizing big data is hard. I think it takes you to be really conscientious and organized, or tidy is the expression my colleague likes to use. So being organized in your file layouts, very clear code books, ways to share your code so that you can communicate across a group can really help, but it does take effort, especially up front, to be organized when you're handling massive data sets with hundreds of thousands of data points and then trying to put together with other secondary data sources as well. It can get really big really fast. So having those systems in place can really help with some of those challenges. And then a third challenge, this is more specific to my research, but measuring neighborhoods is really challenging. We can all think of, if I say, oh, my neighborhood, each one of us is going to have a different conception of what is your neighborhood. And it could be, the space of a block. It could be many blocks. It could be an entire, perhaps, city area, depending on who you are, your activities, your social connections, and your lifestyle. And so we have to make some assumptions that sometimes make me uncomfortable when we do this big data quantitative analyses, where we're having to pick, okay, we're going to do, for example, we're going to use a census tract that unit of about 4,000 people. Okay, and this time we're going to use a buffer of about a mile, so a circle around someone's home. What is captured in that? And like I mentioned, that second in-home survey, the SURF, for regards, they had actually people report to them, how big is your neighborhood? How many blocks is it? And so every time you use a different measurement of neighborhood, you can have potentially different results because of what is captured under that neighborhood. And ideally, we could talk to every person and ask them and get a very detailed map of what is your neighborhood and what's in it. But realistically, when you're dealing with tens of thousands of participants, it's just not necessarily possible to ask everyone, or more importantly, to geocode that data to have that specific measure for every person, an individual buffer of what is their neighborhood. So I think that would relate to, sometimes you have to make trade-offs in what you can do when you work with big data sources. But that's not to say it's not worth pursuing. We just need to take thoughtful approaches and always try to kind of innovate the methods that we use to better capture people and places that they live.
Thank you. Yeah, it sounds like it would be an adjustment. You get used to doing research one way, and then you have to shift it to another way, and then you have to integrate them. Yeah, we host mostly quantitative data within NACDA and ICPSR, and so we have some qualitative data. We even have some GIS data, and I believe some image data, and we're trying to branch out to, other formats as well. And it definitely requires you to know in advance that you have to be organized, like you said, but know that sometimes you're not going to know what that organization looks like until you get into it. So what advice would you like to share to others out there, researchers, new and experienced, who might be interested in the regards data, or I have some bio information we got from you before this, the COVID-19 coping study, or just any advice you would give to researchers using secondary data, or, if they're want to dive into primary data, if you want to get into that at all. But yeah.
Sure. Yeah, I think my first advice is really thoughtfully build your research team or become part of research teams. I think I have thrived in ISR because I've been able to really engage in very collaborative interdisciplinary team science. So I brought a specific set of skills and expertise and methods, and I'm able to pair it with my team that I work with are sociologists, social epidemiologists, demographers, geospatial analysts, just a whole range of perspectives and abilities. And that's really helped us conduct some of these pretty innovative research questions analyses, is because we have such a broad team with so many different abilities and interests to pursue this work. My second advice is also, I'm a big proponent of mixed methods. I think to investigate complicated questions about health and well-being, I think that we need both the depth of qualitative data as well as the breadth of quantitative approaches. And you don't have to use the same data set for both. So in our research, for example, with regards, that's our big national data set, but the qualitative is just 125 people from across the Minneapolis metropolitan area who I got to know very well through my PhD. So we're able to pair two different data sets together. Thankfully, purposefully, they're quite comparable. For example, they're focused heavily on aging Black and white Americans in more urban areas, but you can find ways to pair different data sets together to really be innovative in how you approach the questions and what you can kind of answer. Other advice I have is I learned a lot from the ICPSR summer courses. So I did take quantitative courses, and I'm not paid to say this, but I really enjoyed them. I thought they were really helpful. They were really a great way to feel safe and comfortable to learn. And I never was a kid who enjoyed math, to be honest, and I just loved those classes throughout the summer when I was able to take them and really apply them very practically to my own research, and having these hands-on methods and skills and doing assignments that were literally coding my own research data. I was able to take class assignments and make them work for the papers I was working on and the questions I wanted to ask. For the regard study, I think it's a lot to learn, and that's, as I mentioned earlier, it just takes some reading, it takes some time. The PIs of the study, it's run by people like Virginia Wadley and Suzanne Judd and Jennifer Manley and others. There's a wonderful team, largely out of the University of Alabama at Birmingham. They're very welcoming and very supportive. They're eager and excited for this data to be used and analyzed in different ways. So I'd say don't hesitate, after you've done your homework, of course, to learn about the data sets. You can attend. They have, working group meetings where people who are doing analysis with regards, you could come and learn. There's for example, a cognitive working group. There's an environmental working group, and I'm sure a host of others on stroke or on disability or other, focuses. Or foci, sorry. So, you can get to know who's doing it and get to know them. And then they've been very helpful. Sometimes we've had questions we just can't answer ourselves. And so they've been very welcoming in answering those questions. And then the final is you briefly mentioned the COVID-19 coping study. So this is a data set that I have collected as primary data collection with a colleague at the University of Michigan's School of Public Health, Dr. Lindsay Kobayashi. And so we, early in the pandemic, back in March of 2020, we were of course aware of the news and what was happening, and thought about how the pandemic would have huge impacts upon aging populations, which is the focus of both of our research platforms. And so we developed a mixed method survey to ask Americans age 55 and older about their thoughts about the pandemic, their health and well-being, their experiences and perspectives. We've screened for depression and anxiety and loneliness, and adherence to public health measures. And so this launched in April and May of 2020. We thought we'd have, maybe a couple hundred people take it, maybe 1,000. We also used some funds to pay for a professional survey company to also run it with 1,500 people. And we ended up having close to 7,000 people take the survey at baseline, which was an overwhelming and exciting number of people who I think we might have just been earlier than some of these bigger studies to launch a COVID, packet. And so we just had amazing representation from all 50 states, as well as Puerto Rico and the District of Columbia. And we put this data up to be publicly available on ICPSR's website so people can use this data to answer questions about the COVID-19 pandemic. And so the baseline happened in April and May of 2020. And since then, we did monthly follow-up surveys for a year. So we asked about, COVID testing history and COVID vaccines when they rolled out. We asked about vaccine perspectives. We asked about how your life is changing, your relationships, your neighborhoods. And we've just really detailed data on people's physical, cognitive, and mental health across the 12 months. And now we're also doing annual follow-ups as well. So we're actually just in the next 2 weeks or so, we're about to launch our 2-year follow-up, again, to that all the sample to ask them, how are you doing? What's new? What's different? What has shifted for you? We asked, of course, about work and retirement, about relationships, just getting a really holistic and broad sense about how people are doing and how this really tumultuous period has affected physical, mental, social, and cognitive health. And so this is a data set that we're really excited about and would love to see used by broader researchers. There's just, in a great way, there's just too much data for me and Lindsay right now to analyze by ourselves. So we have a website for it, which you can get to through ICPSR, just to see what's available and come explore it with us and do some cool work.
Wow, thank you so much. Yes, when we share this audio, we will include links to these resources you've mentioned in the description. And I want to thank you for your compliments about the ICPSR summer program. And they're consistent with other people I've talked to who've attended the summer program. People just love, like you said, the hands-on approach, and they look back very fondly on their experience. And we really appreciate that. It lets us know that our summer program team is doing a good job, and that we have good instructors, and and that it, like you said, it actually you were able to practically use those skills. So that's wonderful. Thank you, and thank you for sharing your data. And from what you said about being organized, I'm betting that project is in good shape for sharing and for other people to secondary use it. That's not the right way to say that, but yeah.
Yeah, we have an amazing analyst, Brendan O'Shea, who has organized the data for us, and he is amazing at code books and clearly explaining, providing sample code and whatnot. So he's really been the driver behind getting it organized. And we always knew we wanted to share this data. And so that was always one of our goals from the outset. And Brendan has really made it happen for us.
Oh my goodness, you shared sample code too? Oh, that's wonderful. Thank you. Yes, that's great. And I think a couple times you said something about code books, and I'm so glad you did, because we try to ask similar questions across these podcasts, and there are some themes, and having a good network is a theme. Being proactive to reach out to people behind resources is a theme, and then read the code books. I can't tell people this enough. This documentation is put together with care and with the intention that people should refer to it when they're using data, using secondary data. So yes, read code books. That's a good takeaway.
Yes, 100%. Perfect summary.
Thank you. So we're going to wrap up the last couple questions here. One thing I like to throw in, you kind of touched on, like reaching out to researchers and some organizations and like looking for workshops on the data sources. But are there any conferences that you would recommend or meetings specifically?
Great question. This is a little specific to me and the work that I do. Some of the conferences that I attend are, the Gerontological Society of America. If you're interested in aging research, that is a wonderful, really massive conference that happens every year. From the geography side, I really enjoy the American Association of Geographers annual meeting. And a little more niche, but if you're a health and medical geographer or interested in those kind of neighborhood health place interconnections, the International Medical Geography Symposium, it's every 2 years. It's a relatively smaller conference compared to some of these big multi-thousand person conferences, but I love that conference. It is just a wonderful way to meet like-minded people doing really cool, innovative research on, neighborhoods and health, or I shouldn't say neighborhoods, communities and health, because a lot of them do work, for example, in rural areas. That is another really important area to think about. And that happens every 2 years. And in the middle of the conference, on the middle day, you always get to have a field trip. And so I've gone wine tasting in France. I've gone to look at the sand dunes in Michigan. I've gone and hiked, with some amazing mentors of my field. I remember being on a hike in Whistler, Canada, and talking and getting invited to write a chapter for his new book. So I really enjoyed the IMGS International Medical Geographer Symposium every 2 years. I've also I'm newer to this one, but the IAPHS, Interdisciplinary Association for Population Health Sciences. I'm starting to attend that one. With COVID, it's been only remote so far, but I have heard great things about this conference, and it's especially great for early career researchers. It's just a very supportive environment of people doing, again, innovative and interdisciplinary research. So I'm going to be attending that this fall and really looking forward to having it in person. And I'm also starting to attend the PAA, the Population Association of America conference. Again, this is actually new to me because I'm coming from that geography background and gerontology as well. But I've heard great things about that gives you, it's a bigger conference, of course, but gives you kind of a lay of the land of population level research being done, as well as, experts from each of these big data sets that we've talked about. I'm sure Regards is a large presence, the health and retirement study, Ad Health, you name it. I think there's a great presence there. So if you're wanting to learn how to use data sets, you can just go to talks and get a sense of, again, what's being done, who's working on it, and how are they kind of using the data and asking innovative research questions.
Thank you. Yeah. Are you going to PAA this year?
I'm going virtually.
Okay, cool.
Yes. Yeah, it'll be
That's
actually, I guess I've officially gone once before as a co-author, but this is my first time really attending. Will you be there?
We are exhibiting our first
Fantastic.
conference in person since the pandemic. Mm-hmm.
Woohoo.
Well, thank you so much for those recommendations. And our final question is, what excites you about being a researcher now?
That's a fun question to end with. I think that what is exciting to me is I feel like my work matters. I know it's probably naive and young to think this, but I feel like there's this place for my research to really inform urban planning and civic design. The long-term goal of mine is to build better neighborhoods to help support health and aging. And I view aging as a lifelong process. It doesn't start at some age like 65 or whatever it is. It's something that we accumulate all across our lives. We begin to age the day we're born. So I get excited by thinking that my research can inform real potential upstream changes to what our neighborhoods look like and what we prioritize investment in, and really thinking through those experiences of diverse older adults to be supported as they age in their homes, communities. And I'm excited, as we mentioned, there are so many cool things you can do with maps and kind of how do we communicate research findings to broader public audiences. So I'm really excited about the idea of launching that website publicly so that someone can just type in an address and see how supportive it is to their cognitive health and more, deeper than that, learn about how might neighborhoods impact risk for Alzheimer's and dementia. And then from there, what can I do to decrease my risk? I mean, we're all, more than 6 million Americans over the age of 65 are estimated to have Alzheimer's disease at this time. So what if we can build upstream interventions to really help complement those individual approaches to be healthier, because where we live encourages and enables us to be physically active, socially engaged, and cognitively stimulated on an everyday basis. So that gets me really, really excited.
Thank you. Yeah, I don't think it's naive at all. I think it's wonderful. And it sounds like you're very diligent and you work with some diligent people in your teams and you care enough to try to make an impact. So thank you. Thank you for your work.
Thank you. I really appreciate that.
Well, so I'm going to wrap up here. And, again, thank you so much to our guest and to our listeners for joining us on this podcast. We will share the links to the studies and other resources we referenced in the YouTube description. If you have questions or ideas, please email us at icpsr-nacda@umich.edu. And thank you again, Dr. Finlay. It's been wonderful to talk with you.
It's been a pleasure. Thank you, Catherine.